Hi there, I'm Wendy McCallum, burnout and alcohol coach and wellness expert, and you're listening to Bite-Size Balance, where everyday extraordinary women share their stories, expertise, and wisdom, all in the name of lifting each other up and creating a better life by design. Whether it's wellness, career, relationships, food, alcohol, mindfulness, hormones, or parenting, we talk about all things women's balance. If your life looks great on paper, but it still feels like something's missing, you're in the right place. Welcome to Bite-Size Balance.
Hello, I am recording a short intro to today's episode with Dr. Sarah Baillie. And the reason I'm recording this episode is that you will see at the end of the episode, Sarah and I start talking about this new group program that we are cooking up together. And at the time of the recording of this episode, we didn't have a name for the program and we didn't really have much of a structure set out. But since recording this episode, we have spent a fair bit of time talking about the details of this program and really kind of hashing out what we want it to look like and what we think will be most helpful and supportive for all of you women out there in midlife who are really eager and searching for information and explanations around what is going on with you. So I want to announce a couple things. First of all, we have a program name now and we're super happy with it. The program is called WTF. Yep, you heard that right, WTF. It stands for not only what the fuck is happening to me, but also for Women Talking Frankly. So the program name is WTF, Women Talking Frankly. The missing conversation about hormones, burnout, and midlife. What we are really passionate about, both Sarah and I, as you can probably tell from the many episodes that we have put together on this podcast so far, is really normalizing the conversation around women's wellness and health issues in midlife, because nobody's talking about this. And there are so many pieces of this that need to be discussed, and we need to have information in order to be empowered around our midlives. And that is just not happening. And as I've, said in my own personal story around menopause over the last couple of years, there were so many things that were happening to me and I had no idea they were related to hormones in midlife. And if I had, I feel like I would have, first of all, felt a whole lot better about everything, just having an explanation for it, but also have been more empowered to seek out some solutions in advance and maybe even prevent some of these symptoms that I've been struggling with from getting to the point that they've gotten to. So that is the whole point of this program. The structure of it, we're still working out the little details on it, but the basic structure of it is that it's part course. So there will be pre-recorded modules. There'll be conversations between Sarah and I. So we're going to keep the conversation format in place because that is clearly what works best for us. So they will be conversations between the two of us. We have chosen a set of what we think are the foundation concepts and information that women need to be informed about. And those will form the basis of the coursework, which you will be able to do on your own at your own pace when you have time to do it. But there will also be a component of community and group coaching. And this is really, really important to us because what we also want to do is we don't just want to have the conversation and have you listen to it. We want to involve you in the conversation. We want to create community around these issues. We want to create an opportunity for shared stories so that women can learn from each other and can really understand that they're not alone in this and that perimenopause and menopause are not things that we need to be dreading. Instead, they are just a natural part of being female. We need to start talking about it more. We need to start supporting each other through it. We need to get empowered around what we can do to actually take care of ourselves and feel better during this time. And we also need to celebrate all of the amazing gifts that come with it. So again, the program's called WTF, Women Talking Frankly, the missing conversation about hormones, burnout, and midlife. And the wait list is now officially open. So that's why I'm here today to let you know there is now a wait list for this, which there was not when we recorded this podcast episode. So if you're curious and interested in this program, I suggest that you go to www.wendymccallum.com/list and get yourself on the wait list. At the time of me recording this intro, the waitlist has been open for less than 48 hours and we already have over 30 people on the waitlist. So I know it's going to be a great, robust program and community. I'm really excited about it. We will have to limit numbers in the program because of the group coaching aspect. So my suggestion is, if you're interested in this, if you love the conversations Sarah and I have been having, if you want to learn more and become more empowered around your own wellness during midlife, and also what's available to you after all of this, what's the piece that's missing for you? If you want to explore all of that in a really supportive, fun environment, then I would suggest you pop on the wait list and get your spot, because we will be offering the details of the program and registration to the wait list participants first. So the wait list members will get access to the program first. If there are still spaces after that, then of course we'll open it up to the general public, but the wait list is the place to start. So again, to get on the wait list, it's www.wendymccallum.com/list. And I have also put that in the show notes. So without any further ado, is that a word? I'm not sure. Adieu. Here is my latest conversation with Dr. Sarah Baillie, the Menowhisperer. I hope you enjoy it. Hello, everybody. I am back with the Menowhisperer, Dr. Sarah Baillie, and today we are answering listener questions. So I get regular emails about my podcast from you guys, which I appreciate so much. It's always so great to hear that the topics are resonating with you and you're enjoying the guests. I get an especially large number of emails and messages about my conversations with Sarah. People seem to enjoy our familiar, what do you call it? I don't know. Banter. Yeah. And, in the stories that we share, but also obviously Sarah's expertise around issues relating to women's hormonal health. And so I have been collecting some questions from listeners for Sarah, and we're going to go through a few of those today. So welcome back, Sarah.
Thank you. Good to see you.
Good to see you too. I feel like I see you all the time now, which is great. Side note, I really love Sarah. I actually really like spending time with Sarah. I hope she feels the same way about me. So I don't actually mind. I love these podcasts. They're really fun to do. I also feel less stressed about being very clear in these podcasts. There's less pressure on me because Sarah is well aware of the fact that I never sleep. And I feel like her profession is helping other women who don't sleep. And so she knows what it's like to have like a Swiss cheese brain where you can't keep things straight. Okay, Sarah. So the very first question that we have is, it's a long one. It comes from one of our listeners. She says, "Hi, Wendy. I have a question for the podcast, perhaps for the Menowhisperer. I'm 42 years old and I've been dealing with perimenopause for a couple of years already. I'm on the birth control pill and to help to manage with the very heavy and lengthy periods that I've experienced since the birth of my last child 7 years ago. Things were going well and the heaviness had even tapered off in the past couple of years, so that was nice. But for the last year or so, I've experienced breakthrough bleeding or early bleeding about a week before my period, probably every other month. So I'm having 2 weeks of my period. This is while on birth control. I have an alarm set to take my pill at the same time every day, so there shouldn't be any dipping of the hormones at any point. Is this just another perimenopause symptom? Something I have to live with? Do you have any recommendations? Googling just tells me that breakthrough bleeding should subside after a few months on the pill, but that obviously isn't what's going on here. Thanks so much for any thoughts." So, but before Sarah answers, the lawyer in me must speak as usual to say we are not providing any specific advice on this podcast. We cannot treat or diagnose or provide advice, directed advice to anyone. Obviously, this is just a podcast. Sarah is going to answer the question generally. And everybody who's listening to this podcast, if you're struggling with any of the things that we're going to talk about today, you should go and see a medical doctor or a naturopath. You need to see a treating physician about your own unique circumstances and medical history in order to determine what the right course might be for you. And with that, take it away, Sarah.
Right. So, so when you've been on a hormonal contraceptive for a period of time and it's been working and then it stops working, particularly in perimenopause, it's often that the shifts of hormones in your own body and the way that your body's responding to the levels of hormones from the birth control pill are changing. And so they become less effective. And I would argue that it's possible that if you're having that breakthrough bleeding in the second half of your cycle, then there's a possibility that it's not as effective as a birth control as it should be. And so if you're taking the birth control pill for birth control reasons, then you want to bear that in mind in terms of pregnancy prevention. What can you do about it? So there's really kind of two options. One would be to switch birth control. So go to your family doctor and ask for to try a different birth control pill, or you could ask to experiment with a hormonal IUD. Both of those options may have different levels of hormones in them, and so that they may be able to meet your body where it's at as it's changing. And then the other option is a more naturopathic option, where we would support the hormone shifts by using herbal medicine.
Right. Okay.
Oh,
That's
and then also, just as an aside, acupuncture may help that as well.
Oh, interesting. Okay.
Yeah. So I don't do acupuncture anymore, but most NDs are trained in acupuncture. I refer out to acupuncturists and Chinese doctors, or doctors who practice traditional Chinese medicine,
Right.
to do acupuncture. But a lot of NDs actually do acupuncture, so that may also help that.
Okay, great. Well, there are lots of different avenues there to pursue, but that all has to be done obviously through either a naturopath or your doctor. So go and explore those things. Hopefully that's helpful to that listener. Another question that we have, near and dear to my heart, I'm going to do my best to pronounce this word.
Go.
Oh no, Sarah's been mocking me since our last podcast because I cannot pronounce this. I'm going to try to say it right this time. Okay. It's vaginal, not vaginal, which I cannot, it's for whatever reason, I read it vaginal and it sounds terrible when you say the word that way. So let me try to read this properly. Okay. What is vaginal atrophy and can I do anything about it? And I think this is a question I touched on my own kind of history with this on the Menowhisperer episode, and I would love it if you would answer this question.
So the official term now for changes in the tissues in the vagina and the urethra, which is the tube you urinate from, if
Right.
you don't know that, that's all in the same area, right? So it's all affected by hormones. And the official term for that now is called GSM, which is genitourinary symptoms of menopause.
Okay, well, that is so much better than vaginal atrophy.
Yes.
I mean,
So
what a terrible word.
Canned vaginal atrophy, which is good because it certainly doesn't do anything to help with the image of menopausal women being dried out and old.
Yeah.
So we want to do everything we can to counter that societal image. And the official term now is GSM. So
okay, what is GSM and can I do anything about it? Let me rephrase the question.
Genitourinary symptoms of menopause are, so genital meaning genitals, and urinary tract. What happens is that the decrease in estrogen thins the tissue. And when the tissue thins, if you think about the tissue going from, say, as plump as like your lips, right, to thin like your eyelids,
right,
without estrogen, and that sets up a situation where there's less moisture, there's less plumpness, the tissue can rub together, it can feel like it's stuck. Some women feel that it's not just to do with intercourse. So obviously intercourse can be painful and there can be bleeding, but also some women have just discomfort just sitting or walking because the tissues are dry and they're kind of stuck together. And so that's the vaginal aspect, and the urinary tract does a similar thing, which then leaves the urinary tract vulnerable to more infection.
right.
And so often we see more urinary tract infections in postmenopausal and menopausal women if that tissue is not healthy and the mucous membranes are healthy, because the mucous membranes keep the bacteria out.
Yeah, it makes
right.
total sense.
So
yeah.
You can see more sort of random urinary tract infections, or you can see them associated with sexual intercourse, which would mean that you're going to have that tissue in that area is just not able to eliminate the cross-contamination of bacteria. From most urinary tract infections are E. coli, which is coming from your bowels. So
Right.
there's so that when you're thinking about treating vaginal symptoms or urethral symptoms, you have to weigh out whether it's if someone's having frequent urinary tract infections, they're being prescribed antibiotics over and over and over again. And sometimes they don't even need the antibiotics. Sometimes it's just that it's irritated as opposed to even infected, right? And so
Right.
but these chronic antibiotic use also has that goes into our decision making tree around how and what we use to treat GSM.
Yeah.
It's sort of keeping women from being on antibiotics all the time.
Right.
So there's various ways to approach it. There's some oral supplements in the form of fatty acids, omega-7 fatty acids that can that have been shown there's some research around that. There's some research around hyaluronic acid, which helps to build the tissue back and create moisture. And so those would be non-hormonal. And there are a number of products on the market that contain hyaluronic acid. That's kind of the big one that's been studied in the more natural world, and even in sort of non or more pharmaceutical brands, they will have hyaluronic acid in there. And as you said on the last podcast, it's also the thing people put on their skin, right? So like it's, it sounds scary because it sounds like an acid, but it's actually, it's an acid that it's part of your tissue. It's naturally part of your tissue. It's naturally part of joint tissue as well, and bladder tissue and so that's one way, is products with hyaluronic acid. And then if we're not having success with that, and it's warranted from a whole person perspective, you can look at a couple of different forms of topical estrogen or intravaginal estrogen in order to rejuvenate that tissue so that it comes back to health. And this is one of those things that if a woman has GSM symptoms at 50, then and it's untreated, then what's going to happen by the time they're 80, right? So this is definitely tissue that you want to look after.
Yeah. So that is actually segues right into something I want to talk about. It's not a question, but it was, as you were talking, I was thinking we haven't actually talked about this yet. And I know this is going to come up again and again in our conversations, but it's something that has become incredibly clear to me in the last year of going through all these symptoms, is that we are just so complicated. The human body is such an amazing thing that some entity, something had to have put thought into this. Like it couldn't have just spontaneously occurred this way. We're just so incredible the way our bodies work. And so I have been thinking about lately, I'm like, what is the explanation for why women suffer in menopause? Like how could this possibly be kind of meant to be that part of this, whatever this system is that we live in, as physiological creatures, like how does this make sense? Because it's pretty horrible. Like there are a lot of really tough things that we have to struggle through, and men don't have to deal with the same things. They have some of their other stuff, but it's not the same at all. So I've been trying to rationalize that, like, why is this? And as I've been doing research and talking to you, it's just become like so obvious to me. I mean, we were never really meant to live much longer than menopause. I mean, we really weren't, if you look back in history, I mean, we would have been, again, I'm going to totally botch this because I don't know the years, but a couple hundred years ago, we probably would have not been alive at 50 plus, maybe it's more than a couple hundred years
I think
ago.
more than a couple
Please
hundred
don't
years,
come after me like anthropologists or whatever. I have no idea what I'm talking about. Historically, periods in earlier history, earlier humans did not live this long. We're living longer and longer as a result of the advances that we made in medicine and, the improvement in our standard of living and all of that stuff. We're living longer and longer, but we're really not designed from a physiological or biological perspective to live as long as we're living. And so it does make sense that, menopause would come towards the end of the natural life cycle as maybe it was meant to be, I don't know, evolutionarily or whatever. And then that would be the end of life. So we would really not suffer that much, it would just be kind of the natural decline. However, we're all living for like another 30, 40 plus years as women after menopause now. And I think that has become so obvious to me. And I've been thinking, about it a lot. And we're not designed to live with menopausal symptoms for 30 to 40 years. We're just not. And it's not fair. And for some women could be a pretty horrible existence, to be perfectly honest, because some of these symptoms are not fun. Like the one we're talking about right now, this GSM, thank God there's another word for it and I don't have to pronounce vaginal again. But dealing with GSM for the rest of your life and having, if that came with chronic urinary tract infections and painful intercourse, I mean, it just can completely destroy your quality of life, to be perfectly honest. Right. Just that one symptom. So I think it's really important for us to remember that. And the reason I say that is I think we need to start getting more proactive about our own health. And I think we need to not be ashamed whatsoever to be asking for and seeking out and experimenting with whatever things are available to us that make sense for us, again, as whole humans, because there are a whole bunch of factors that go into what treatment is the right treatment for you. But I think we need to start recognizing that we can live the next 30 to 40 years without estrogen and have all of these symptoms that go along with that, along with a bunch of other ones, which you and I are going to talk about. We're going to do a whole episode on hormonal therapy, because that's something that deserves its own hour. It's so complicated, and we'll talk about that. But there are so many other symptoms of decreasing estrogen that we don't really talk about very much that, over time can become really big chronic problems for women. So anyway, my point in this is just to say, we're not designed to live for another 40 years, but we're living for another 40 years. And so if you're struggling with this, like I was, as I said in the last episode that Sarah and I recorded together, the Menowhisperer episode, this thinning of the tissues was happening for me. And I did not know what it was. And when I look back on it now, it's been getting worse over the last few years. But when I hit full menopause, it just skyrocketed and it became very painful. And I have now found complete full relief. I said on the last episode, and I'll say it again, I'm using a hyaluronic acid moisturizer. I'm not going to say the V word. It's a V word moisturizer, guys. It's only because for whatever reason, the word is now creeping me out because I keep saying it wrong. Not because I'm embarrassed to say the word, guys. Anyway, that moisturizer has been a complete lifesaver for me. It's very, very simple. It's clean. It's just hyaluronic acid and water. So it doesn't have any other stuff in it that you might not want to be putting into your body. And the particular one that I use, I'm happy to share it on the podcast. I have no affiliation with this company. I am using one from a company called Pure Pharmacy. And if you Google it online, you'll find it, Pure Pharmacy. And the name of the moisturizer is hyaluronic acid. Okay, I got to say the word, vaginal moisturizer. That's what it's called. So hyaluronic acid vaginal moisturizer from Pure Pharmacy. I did try some other ones. They did not have the same effect. So this one for me has been the best one. That does not mean the other ones aren't good. It just means this was the right one for me. And I just wanted to share that. So, okay, that's great. Thank you for answering that question, Sarah. Next question we had is, I've been having really sore joints. So I've just been noticing that I'm really sore and I've had increased joint pain. Could that be connected to hormonal shifts?
Yeah, that's another a loss of estrogen symptom for sure. So, the tendons, everything, I just need a new word for this, but everything gets a bit drier.
Yeah.
Right? Not as plump.
Depleted. Can we say
depleted? That even feels, I just don't even know how to say this it's like looking for a PC way to say it. You know what I mean? Like a positive way to say it.
You could say less moist, but everybody hates the word moist. So
yeah, I hate that word. So, you can see it as a menopausal woman now, you can see it in your skin. Like you can see that there's less elasticity, right? So that's why the wrinkles come, right? Because of less elasticity. And so your joints need that elasticity as well. Mm-hmm. And so that's part of where joint pain comes from. It also leaves you more, as I spoke about on the last one, it leaves you more vulnerable to injuries that don't repair very well.
Right.
So, that is definitely part of that menopausal thing. Now, I also have to say that generalized joint pain is something that you need to make sure that you have checked out with your family doctor or your naturopath, right? Because, there could be, we are also at menopause aging, right? Yeah. So it's not just about hormones, right? There are possibilities that there could be things like rheumatoid arthritis, or there could be food sensitivities. Food sensitivities sometimes crop up in perimenopause and menopause that weren't there before. And lo and behold, we might think it's estrogen, but then somebody decides to do a gluten-free diet for 6 weeks and discovers that gluten's actually creating their joint pain.
Right.
So we don't want to blame everything on hormones just because that's just what we're talking about. So with joint pain, we want to make sure our thyroids are healthy. We want to make sure that our hormones are healthy. We want to make sure that our immune systems are not attacking our joints. Those are all things that we have to rule out as well. So don't hesitate to make sure that those things are ticked off your list before you say, oh, this must be hormone related.
Yeah. Yeah. But it can be hormone related. And I think
Absolutely.
as I mentioned in the Menowhisperer podcast, that was one of the big symptoms for me and just really cropped up in the last few months. And there really is no other reason for it that I can think of, to be honest. And it really came on with these other symptoms where I just feel very sore. Getting up, getting out of a chair is hard. Whereas, a few years ago, I just hop right up. I feel this joint pain and I exercise regularly and eat well. And I take the omega-3 fatty acid supplements and I take the vitamin D. I do all the stuff. And now I'm taking an eggshell membrane supplement that you actually recommended for me that I actually think is helping a lot with it's certainly helping with my knee, like my joint pain in my knees. But, again, this is just one of those things. It's like your estrogen is low and it ain't coming back, people. So are you going to live for 40 years with this? If it is joint pain related to estrogen, which again, it might be related to other things, but if it is related to the hormonal stuff, I think it's worth advocating and exploring for yourself. Don't just assume it has to be this way, I guess, is my message. It doesn't necessarily have to be this way. There are lots of different things that you can do and avenues that you can explore. Okay. I got another one here. This is the last one, Sarah, for today. My mood is all over the place since I hit perimenopause and it's driving me crazy. Welcome to the club, my friend, whoever this is.
We have talked about that a little bit.
What can I do to feel more balanced?
Yeah, so that's a multifactorial situation, right?
Yep.
So we have talked about the aspects of hormone balance. So finding someone to help you make sure that your peaks are not as high and your lows are not as low in terms of hormone balance. That's really helpful. That can take the edge off for sure, is to get the right herbal combinations going on in there. We also want to make sure that you're exercising. So exercise is really critical. And I find that for a lot of women in their mid-40s, it falls off. Yeah. And particularly this last year, because everybody's lives have been so disrupted by COVID, people's exercise levels have changed dramatically. So exercise is important for endorphins, right? It's important it's a mood enhancer. It's really, really important to exercise and nature, exposure to nature, right? Green space, very important for mental health. Yeah. So there's that. There's also making sure that you're taking care to do things that you need to do for your own mental well-being. So doing 5 to 10 minutes of meditation every morning can be helpful just to set the stage for the day. Recently, I've been saying to people who are in an office setting, like, take 5 deep breaths when you go and have a pee. Like, no kidding. Like, if you can't actually get it into your day, just spend an extra 2 or 3 minutes in the bathroom and just do some deep breathing to change your cortisol levels, change your stress hormones. The stress hormones make you more irritable and more vulnerable to mood changes. Getting rid of coffee is important because that can really increase anxiety and irritability. Looking at your alcohol consumption, important. Making sure you get enough sleep. So those are all really important things, as well as staying away from sugar. Yeah. So sugar can really, as I've said before, and we'll talk about again a number of times, I'm sure, perimenopausal women are hypersensitive to lots of things. And so sugar, caffeine, and alcohol are the top 3, and they are going to affect how you feel in the day. There are other, there are supplements that can help, but again, you need a practitioner to be able to support you with that. So there is hope. There's absolutely hope to be able to help with your mood. Yeah. It's just that it's not a quick answer usually.
Yeah, no, I kind of echo that from the burnout side of things with mood. I mean, there are lots of things that you can do, and actually just episode maybe 30 or 29, I talked about a few simple ways to actually slow down, and they're right in line with what you were just talking about with the breathing, taking the time during the day to breathe a few times. It doesn't need to take up a lot of time in your day, but it can make a really big difference to just consciously remind yourself to slow down and take a little bit of a break a few times during the course of the day to bring your cortisol back down. The other thing that I would add to that is, gratitude can go a long, long way.
Yeah.
The practice of gratitude can go a long way to improving your overall mood. And I don't need to get into that in any detail now, because there's a whole episode that I did on gratitude and how to start a really simple gratitude practice and what you need to know to make it actually have, the neurological impacts that gratitude is capable of creating for people in terms of how their brains are wired and work. So go back and listen to that episode. If you're struggling with your mood, that might be helpful as well. But as Sarah said, there are lots of different ways to approach this. And as with many of these things, and I've said this before, I think it's, this idea of there's not one thing that probably is causing your mood to be unpredictable. And so you can't expect that there's one solution to get you back to where you want to be. So it's probably a situation where you want to try a variety of different things, maybe some supplement type approaches. You may need to go see your doctor about, it may be an issue that where you might benefit from pharmaceutical support. Everybody's different. But there are lots of different avenues that you can explore if you're struggling with an unpredictable mood during perimenopause. And you are not alone in that. It is a very common thing that women struggle with. Okay, well, thank you, Sarah. That was us answering listener questions, and we're always happy to answer questions from you guys. So if you have something that you want to ask me or Sarah, you can send those to me at wendy@wendymccallum.com, or you can, DM me through any of my social media channels, which are at Wendy McCallum Coach on Facebook and Instagram, and I will collect them for another installment of Ask the Coach and Naturopath. And as we mentioned on a previous episode, we are cooking up something really cool for you guys in the form of a program. Sarah and I are creating something. I think it's going to be a really exceptional program that's going to provide you with more information and education, but also a community of like-minded women struggling with the same things, and the opportunity to ask us questions and get some direct coaching as well from me. So more details on that to come. But for today, thank you for tuning in, and thank you, Sarah, for answering all those questions for our listeners.
All right. Have a good one.
You too. Thanks so much for listening to today's podcast episode. I hope you enjoyed it. Just as a reminder, the program that Sarah and I talk about in this episode is now officially happening. It is called WTF, Women Talking Frankly, the Missing Conversation About Hormones, Burnout, and Midlife. And there is now an official waitlist for that program, which is filling up quickly. So if you are interested in learning more about this program, it's not a commitment to the program by joining the waitlist. It's just an opportunity for you to get early access to information about the program and also kind of first dibs at those spots. So if you're interested in it, I highly recommend you get yourself on that list. The list, again, can be found at www.wendymccallum.com/list. That's WENDYMCCALLUM.com/list. I would love to have you join in our conversation. Have a great day.
You've been listening to Bite Size Balance with your host, Wendy McCallum. As a burnout and balance coach, I help busy high achievers like you create a more balanced, joyful life. Ready to create a life you don't want to escape from? Download your free Blueprint for Change now. This incredible workbook includes some of my favorite coaching tools and will help you get clear on what you need more and less of in your life. Grab it at www.wendymccallum.com/blueprint. That's www.wendymccallum.com/blueprint.